Also get a view from Dr. Raghuram Rajan. ET now spoke to Dr. Raghuram Rajan, and let's hear out what Dr. Raghuram Rajan has to say about the economic lockdown.
It's not a stark choice, saving lives or saving livelihoods. You have to actually do both. And that means that on the one hand, you can't remain in lockdown forever. That would be focusing only on saving lives. But in the process, if people don't have livelihoods, you may also impact their lives. And, we don't have distribution systems that reach everybody in India, especially the very needy, the very poor. Often they're left out of the distribution system. So we have to make a trade-off where we focus on both, but try and do a little bit of both at the same time. What that means is that we have to think about a staggered restarting of the economy, start first with the areas where it's least vulnerable, and then move to the areas where it's most vulnerable. But of course, what this means is an enormous amount of administration goes into the reopening, perhaps even more than fighting the disease.
IMF Chief Economist Geeta Gopinathan and her thoughts to the Times Network. This is the worst financial crisis since 1930s. The government will need to provide unprecedented support. Uday Kotak also, he's giving a medical example. I'm going to just read off his latest tweet. Coronavirus death per million, India has outperformed. Furthermore, our daily numbers are not sharply spiking despite increased testing. Lockdown has been a medical success. Time for now to focus on a livelihood. So the intention now, or the post the medical success, it's time now to shift back to the economy. That's the point I guess we are arguing and we are debating. The point I'm simply trying to make here is that a car has four wheels. One is the medical emergency. Second is what we do in terms of maintaining social distancing. Third is the economy. And for economy to function well, you need the transaction or the economic activity to start. Otherwise, things will come to a grinding stall. India cannot afford a lockdown further because A, we don't have ability like other developed countries to spend and to splurge, and B, given that we are still dependent on foreign capital, I guess it is important to understand that foreign capital will only be coming when they get a sense that the economic activity has started normalizing.